Hello, everyone, and welcome to COVID Chat Volunteer Essentials. So, the overall aim of the slides and the training is to find out more about the volunteer role and how to have effective COVID chats. So, the aim of this small, short screencast is to test your knowledge about COVID-19 and to have a clear understanding of what a COVID chat is and what a COVID chat isn't. So, what is COVID-19? COVID-19 is a very infectious disease that affects your lungs and breathing. How is it spread? COVID-19 is spread by breathing out, sneezing, or coughing infected water droplets into the air. What are the symptoms? The main symptoms of COVID-19 are a high temperature, a new continuous cough, and loss of or change to taste or smell. So with the new Delta variant, there are new symptoms to look out for, which is diarrhea, a blocked or runny nose, aching muscles, a long-lasting headache, vomiting, a sore throat, and a general feeling of tiredness and unwell. And if in doubt, you need to take a test. What do I do if I think I have COVID-19? So if you think you have COVID-19, you need to get tested as soon as possible and self-isolate until you get your results. What is a vaccine? A vaccine teaches your body to fight off diseases by giving you a very small part of the virus. What vaccines are available in the UK? The COVID-19 vaccines currently available in the UK are the Pfizer vaccine, the AstraZeneca vaccine, and the Moderna vaccine. What can I do to keep myself and everyone safe when I'm fully vaccinated? Even if you've had your vaccine, you still need to remember hands, face, space, and fresh air. So I'm going to play you two short films now with Cordell Afori, who is a public health consultant for Greater Manchester, and she's going to tell us a little bit more about the COVID chat programme.
Hi, I'm Dr. Cordell Afori. I'm a public health doctor for Manchester City Council and Manchester Health and Care Commissioning. Welcome to Manchester's COVID Chats programme. I'm really excited that you're working with us to help the people in Manchester from our Black and Asian communities to really have an opportunity to understand what's going on with COVID-19, how it can affect them, and what they can do to keep themselves, their families, and their communities safe. So, what is a COVID chat? We're calling a COVID chat really any opportunity that somebody from a Black or a South Asian background who lives or works in Manchester to get some time to have a chat with somebody that they trust, somebody that they feel they could connect with, somebody who gets where they're coming from, and somebody who's credible, who has some knowledge about the COVID-19 situation, whom they can really just have a chat, share their concerns, talk about what's bothering them, talk about anything that they may have heard about either COVID or the vaccine that might be bothering them, that they don't understand, that they might be confused about, and really just get that time to be listened to and to be heard so that they can really start to make an informed decision for themselves about how best to keep themselves safe, their families safe, and their community safe.
And this next small short film is talking more about what sectors of our society we are trying to reach with the COVID chat programme.
Why are we focusing on people from Black and South Asian backgrounds? So we know that, there are lots of people in Manchester of any background from whom this has been a really, really, really tough year. It's been a tough year for all of us. But what we've seen from very early on in the pandemic is that some people have been disproportionately affected by the disease. So there are some people within our communities and within society who have tended to get COVID more badly, so they've been more likely to end up in hospital. They've been more likely to end up needing critical care or intensive care, and really sadly, they've also been more likely to die. The other thing we've seen over recent months is that there are similar groups of people who are also less likely to have had their vaccine for a variety of reasons. In Manchester, when you add those two things together, the people for whom we've really seen the biggest challenges, if you like, have been Pakistani people, Black African people, Black Caribbean people, and people who have a mixed heritage, mixed background. We do know that there are people of other ethnic backgrounds who were also adversely affected by COVID. So in terms of getting seriously ill and dying, we did see that for Bangladeshi people, Indian people, and at times Chinese people as well. But more recently, in terms of vaccine coverage, so that's the proportion of people who are eligible for their vaccine and who have had that vaccine, coverage has been lowest for those three main groups: Pakistani people, Black African people, and Black Caribbean people, as well as people of mixed heritage. So for that reason, we're really focusing on trying to give those people an opportunity to have a chat first before we open this out more broadly to other people. Why are we focusing?
So, as Dr. Cortella Fori was saying, the percentage of people who have been offered an appointment and received the first dose of the vaccine in Black, African, and Caribbean people, the uptake is 49%. In Asian, Pakistani people, it is 54%. And Asian, Bangladeshi people, it is 61%, compared to white people, where the vaccine uptake is 78%. Now, I'm aware that these figures are from the beginning of March, but current, more up-to-date figures suggest that the vaccine uptake amongst these sectors of society is around the same. So, what is a COVID chat? Well, a COVID chat is not about persuading people to have the vaccine. And it's not about telling people that they need to get vaccinated. And it's not about telling people what you think. And it's certainly not about telling people that they are wrong in their choices. So a COVID chat is more about talking to people to find out about their barriers and concerns about vaccine and COVID-19, to make people feel supported in the decisions they make, to listen to their concerns about the virus, and to give people accurate information about COVID-19 and the vaccine if they would like to know more about it. So depending on your circumstances and your community, your COVID chats may be planned or may be incidental. So if they are planned, they may be a list of contacts may be given to you by your volunteer coordinator and ask you to contact them because they have requested a COVID chat, or they may be incidental. So that might be you see somebody in the playground and have a chat about COVID-19 with them, or it might be at the shops, in your church, or in the mosque. So they could be, COVID chats could be face-to-face, over the phone, or even online. And your volunteer coordinator will talk to you more about this. So this is the end of this short film. And in our next session that I'm going to make a film about, we're going to check how you can find reliable sources of information and to check if they're accurate, and where you can find culturally appropriate information that is reliable and up to date. So thank you very much. Bye.